Mhm.
Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I will be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Good morning. I'm doing fine.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and U.S. COVID statistics through today, December 14th. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with this week's updated COVID statistics, average new hospitalizations per day are 3,216. In 2022, the same week, we saw 4,843. Average COVID deaths per day are 103. In 2022, in the same week, we saw 370. And the new vaccine uptake for adults is 17.2%. For those 65 plus, it's 36%. And among children, the vaccine uptake for COVID is 7.7%. Dr. Murphy, your reactions to those numbers?
Well, the overall hospitalization rate is up, and the death rate is about the same that we've been reporting for the last couple of weeks. It's in the 100 range. The problem is that these new variants are so contagious that just so many more people have COVID now, and they don't think much about it. You know, they take their Paxlovid if they can get their doctor to give it to them, and they put a mask on, and they get better quickly, generally. But the vaccine uptake is really very poor. Only 17% of adults, but on the 65 and older that really can benefit from it the most, it's 36%. That's a little good, a little better, excuse me, my grammar. It's not as high as with adults taking the flu vaccine, which is 67% people over 65. So for some reason, they're not taking as much of the COVID, and COVID is actually a more dangerous disease. And with children, the numbers are very low. And with flu, 41% of them are taking the flu vaccine and only 7.7% taking COVID. So it's just unfortunate, because this is going to keep people out of the hospital. And we're just entering now the high respiratory disease period. So December, January, February for the most part. And we're going to see a lot of this because these protection rates from the updated vaccines for flu and for COVID, and also RSV is now available for people over 60, and that's only 16%. It's so low. So if you want to protect yourself, you want to take these vaccines, the new ones.
Mm-hmm. And speaking to those vaccination results and the efficacy, there was a study released about children specifically and how the COVID vaccine can reduce some of those severe effects of COVID. Can you tell us a little bit about that?
Yeah, for those of you that have children or are around children for whatever reason, I mean, the scariest thing is when a child is sick enough to end up in the hospital. I mean, it's really frightening. And what this study shows, 7,434 children. This is from the state of New York, which has a very good health department, and they follow all the data very closely. So, the flu vaccine is recommended, flu and COVID, from, very, very early on. And if they take the COVID vaccine, the emergency room visits and hospitalizations are decreased by 40%. That's huge. That's almost half. So, and then, the reason for this is that the uptake of vaccine in children is so low. So the only thing you can do to prevent it, unless you just want to isolate yourself in a little mountain someplace, is to take a vaccine. It's just the way it is. If you want to go around living as normal a life as possible, you want to prevent this with the kids. And so, you've got all these things to worry about. Everybody's going to be coming down with some kind of respiratory infection, and you don't want to be the one that ends up in the hospital.
Absolutely. And same topic, but moving on to another group that is at risk and very highly at risk for COVID throughout the pandemic, those with systemic or rheumatic diseases. There was a study released about vaccine efficacy for those individuals. Can you break that down for us?
Yeah, so what you're referring to is a disease referred to as systemic autoimmune rheumatic disease, SAIRDS, SAIRDS, I guess you pronounce it. And they've always been very concerned, are they more at risk for COVID and more at risk for complications and whatever. And so this is a nice study, 456 people with this syndrome, this disease, and they got COVID. And the most common underlying disease that falls within the syndrome is like rheumatoid arthritis, lupus, psoriatic arthritis, systemic sclerosis, and vasculitis. There's this like family of diseases. So all of them are thrown in there. And among the overall impact was quite dramatic in terms of how they did based on whether they took the vaccine or not. And like, we're not saying they took all the vaccines or anything. They're kind of just, now if you've had anything, you get thrown in vaccinated group. Among the unvaccinated individuals, these 456 people, basically 25% ended up in the hospital and 4% died. And among the vaccinated patients, it was 12.5%, or half as many were hospitalized, and 0.8% died. So the death rate was reduced, dramatically from 4% to less than 1%. So that's very significant. And it's just it's evidence that the vaccines work even in this very difficult to treat population. So that it's very good news to see the science come out to support this and to show that even in a group, this immunodeficient or immuno-altered group, how well they can do. But they have to take.
Absolutely. Yeah, because there was concern about that when vaccines were first coming out, about those who were, immunocompromised, maybe getting an extra shot, something like that to help compensate. So these results are really, really awesome to see.
We're giving the transplant patients an extra shot. I mean, all sorts of stuff. But if you get the vaccine in there, it has a dramatic effect.
Mm-hmm. And lastly, you touched on this a little bit earlier, but there is a new COVID variant that is taking up a lot of attention. Can you tell us what the variant is and why it's caught, agencies' eyes?
Yeah, there's a new Omicron variant called JN1. And this is a descendant of one of the other Omicron variants that have been swirling around the world, the BA.2.86. And it's taken over. So, it's taking over. It's really climbing significantly. And that just means that it transmits faster. And that's why we're seeing so much COVID now. The hospitalization rate is up a little bit, but we're seeing a lot more COVID. We don't know the numbers now because we don't bother to count them. But I mean, I can tell you, just being an infectious disease doctor here in Chicago, it's just like rampant. But anyway, it's a new variant. It's more contagious. So Omicron's here to stay.
Absolutely. And we saw it was a huge jump percentage-wise in the span of 2 weeks. It was 8.1% prevalent to 21.4% prevalent. So that is just huge growth in a short amount of time.
It just takes over.
Mm-hmm.
It transmits easier. Every new variant is easier to transmit. Highly transmitted disease.
Switching over to long COVID, we have a lot of interest in long COVID. We get a lot of stories and studies on the topic. However, there was a really excellent study that was just published about treatment of long COVID and some success that was seen there. Can you break down that news for us?
Yeah, the long COVID patients, of which there's millions, there hasn't been any real reports that treating long COVID with any specific therapy for the COVID part helps. Yes, if you have some symptoms, sometimes some of the medications can treat the symptoms, but the underlying problem is not going away. So we knew that the gut, your stomach, is full of all these bacteria, and that when you get sick, oftentimes that gut flora changes, and that can have some adverse consequences. So this is a study of how many people? 463 people who have long COVID. And they got this treatment called SIM01. And it's a symbiotic preparation that has a whole bunch of different bacteria in it. All right. And they gave it to people in a placebo-controlled study. So nobody knew, the people didn't know, and the doctors didn't know if they were on placebo or they were on the treatment. That's what we call a double-blind placebo-controlled study. And lo and behold, they found that after taking this for 6 months, fatigue, memory loss, difficulty in concentration, gastrointestinal upset, and general unwellness all improved on the treatment group compared to the placebo group by a significant factor, like 2 or 3 times greater chance of improving. So this is really incredible. There's this kind of treatment, there's no adverse event rates. I mean, they were similar between the groups. It didn't really cause any significant problems. So this is something that's, I think, going to become, this is going to have a major impact, I think, because people will study it even more formally and in bigger studies. But it's not that hard to get this kind of stuff. Or, technically it's not hard. You can't walk into the pharmacy and get it, but, it's something that could be done and manufactured easily.
Mm-hmm. And that's just absolutely great news to hear some positive news about the treatment and something that's working. So we will, of course, keep our eyes on it.
Surprised to hear this, and because it's been tried before in other diseases and stuff, and for Clostridium difficile, we know it works. If you have the diarrhea from the antibiotics and they take this kind of stuff, it works. But not in a disease like long COVID. Long COVID is such an unusual syndrome.
Mm-hmm. Yeah, so that is great news. Of course, we will keep you updated on anything else that comes out around that SIM01 or long COVID research generally. But transitioning into more of a global scale, we saw that 3 more countries this and last week reported more cases of polio. Can you please break down those cases for us?
Oh, this is terrible. This is why we can't let up the polio problem. I mean, polio was almost eradicated. And now Pakistan, the Democratic Republic of the Congo, and Nigeria all have reported new cases. This is really unfortunate because it was just a couple of years ago that they hadn't seen any cases in Africa and they thought it was polio free, but it's back. And that's unfortunate. It's not a lot. It's just in the single digits and stuff, but that means it's still there. And you've got to, work in those areas to, again, a vaccine to prevent polio, because of course there's no treatment for polio, and polio can be quite devastating. So it's we have to just continue to be vigilant, and around the world, this is a global problem. This doesn't, if we don't get rid of it everywhere, it will come back.
Mm-hmm. And finishing up today, a rather startling story out of Zambia, which has reported a suspected near 700 anthrax cases and 4 deaths. Can you please tell us a little bit about this outbreak?
Yeah. Remember anthrax years ago when there was powder sent to people in the mail and stuff, and never figured out who did it, but you can die from anthrax. So Zambia and Southern Africa had 700 suspected cases with 4 deaths. And that number 700 is more than previous outbreaks in 2011, 2016, and 2017, which had 511 in total between them. So something's going on there. And you know, they get sores on their face, arms, and fingers, and you know, it's from dealing with animals that are infected. And you know, it's just it's troubling. So that's kind of the news. There's a couple other things people might be interested in. Number one, there was a report that just came, I read it this morning, so we don't have it in our official notes, but the number of cases of dengue disease. It's a viral disease from mosquitoes that causes a very serious systemic illness with, you know, fatigue and everything. You can also die from dengue if you know, if it's bad enough. But the number of cases has skyrocketed, and they think this is due to the expansion of the area where the mosquitoes that spread dengue has expanded because of global warming. And so this is all over the Caribbean, in the tropical areas of the Americas. So it was a, you know, it's a real wake-up call. Now dengue, there's no vaccine for it, and there's no treatment for it, but you know, that may change at some particular point. The other thing that was reported, again, I read this morning, was there's a new flu vaccine that's a, quote, recombinant vaccine. In other words, it's made from proteins, and they just make the vaccine. You know, current flu vaccine is made with eggs. You know, I mean, it's an old technology. It works, you know, but you got to use real eggs, which is just, you know, hysterically funny considering how far advanced we are with vaccine manufacturing now. So if it's supposedly just a preliminary report, but supposedly it works just as good, if not better. Two things, if this pans out, this is huge because it'll be cheaper to make, and egg prices will drop. So people may be,
absolutely.
Remember how the egg prices went up when all the birds died of avian flu?
Oh my gosh, it was like 20 bucks for a carton of eggs.
Egg prices are up. Yeah, egg prices are up because all the chickens died. Well, you know, chickens grow pretty quickly, and they just grew more chickens, and the avian flu thing calmed down. So, you know, the egg prices came down. But if the governments aren't buying all these eggs, of course, those people that big customer is going to go away. So, you know, egg prices may drop. That's just I don't know. I'm not a stockbroker or anything like that. I have no idea how to invest in money, but I can tell you that it would be interesting if we don't have to use actual eggs to make this vaccine, which seems very plausible.
Yeah, that's really fun news, and also just great news generally. I will keep an eye out for that, and I'll include these stories next week so we can go more in depth for all of you about the details. But I'd like to thank you, Dr. Murphy, for your time and expertise breaking down these articles, the papers, the US COVID statistics. It's greatly appreciated.
Well, thank you very much, Katie, for all your hard work, and thank you everyone for watching.
Thank you. Yes, thank you very much for watching and joining us. If you have any questions, please feel free to leave them down in the description or down in the comments below, and see any of our social medias in the description. Thank you, and we'll see you next week.
Thank you very much.